Administration on Children, Youth, and Families, and also serve as Acting Associate Commissioner of the Family and Youth Services Bureau. I want to thank all of you for your hard work and your diligence in responding to the General Departmental Funded Sexual Risk Avoidance Education Funding Opportunity announcement in May. And I commend you on submitting such thorough and well-developed applications. I think our youth need your programs now more than ever. This has been a very difficult year for all of us, but particularly for young people who have been home, not at school or work or with their friends. Of course, we're hearing that many are depressed, bored, uncertain for sure, and that calls to abuse and suicide hotlines are on the rise. Parents and caregivers are suffering in different ways too. So it's important to empower our young people and give them reasons to look forward to a brighter future. A future without pressure to engage in risky behaviors, including sexual activity outside of marriage, encouragement about the success sequence, graduating from high school, and they will, getting a full-time job, and waiting until marriage to have children. You will be conveying positive messages like the holistic individual and societal benefits associated with personal responsibility, self-regulation, goal setting, healthy decision-making, and a focus on the future. I'm pleased to say that FYSB has awarded a total of just over $21 million for the new GD SRAE grants to 51 organizations that educate youth on sexual risk avoidance, including 33 first-time grantees. We can't wait to see and to help foster your success in providing prevention education that supports youth. Of course, you're already familiar with the APP program, as evidenced by your applications. But today's orientation provides the opportunity to look closely at the inner workings of the legislation, the processes and practices of properly managing your grant, and the resources available to help you do so. There will be a lot of information, so make sure you're comfortable and engaged, and use the chat box to ask questions along the way. During this orientation to the General Departmental Funded SRAE program, you will be introduced to a great FYSB staff. We'll provide an overview of FYSB and the APP program and requirements. We'll review the guiding legislation for our work and introduce training and technical assistance resources and partners. We'll also present an overview of the role of the HHS Office of Grants Management and resources that are available to grantees. Plus, we'll show you some of the readily available tools and resources at your disposal, like the Exchange, which is an interactive activation platform for APP grantees, partners, and stakeholders to help increase your visibility and the impact of your efforts, your programs, to prevent pregnancy among vulnerable youth. And the We Think Twice campaign, one of my personal favorites, designed with youth, for youth, to promote healthy relationships, goal setting, and empowerment to take control of their own future. You'll also hear about the SRAE National Evaluation and the support our National Evaluation Team provides for building data capacity and local evaluations. We want to gather really good evidence and data about the efficacy of your programs. We highly encourage you to conduct continuous quality improvement and local evaluations to further our understanding of the anticipated outcomes and impact of your projects. Once again, I'm very happy to welcome you to the APP program, and remember, FYSB is here to provide you the assistance, guidance, resources, and support that you need to be successful in all aspects of your programs. So congratulations, good luck, and thank you for your continued commitment to our youth.
Education Program, New Grantee Orientation. I am Alexandria Washington, one of the project officers with the Adolescents Pregnancy Prevention Program. At this time, I will provide an overview for today's webinar. You have been greeted by our commissioner, and additional staff introductions will be shared momentarily. We have a robust agenda as we provide critical information to support your successful implementation of the General Departmental SRAE projects across the nation, to include an overview of the Family and Youth Services Bureau and the Adolescents Pregnancy Prevention Program, General Departmental funded Sexual Risk Avoidance Education Program goals and objectives. We'll then talk about performance measures and evaluation, training and technical assistance, websites and resources, APP program office roles and responsibilities. The Office of Grants Management will provide some information on their roles and responsibilities, and then we'll leave time for some questions and answers. The FYSB leadership and Adolescents Pregnancy Prevention Program staff are Debbie Powell, who serves as FYSB's Deputy Associate Commissioner, Risa Matthews, the Director of the Adolescents Pregnancy Prevention Program. Our program managers are Labrita White and Renee Martin. The project officers are Jessica, Christine, Tanya, Letitia, Patrice, and Latonia. And our program assistant is Tarshika Thompson, and our communications manager is Owen Burns. I'm now going to share some information regarding the Family and Youth Services Bureau and the Adolescents Pregnancy Prevention Program, which we refer to as the APP program. The Family and Youth Services Bureau, or FYSB, is located within the United States Department of Health and Human Services Administration on Children, Youth, and Families. The Bureau is comprised of two divisions: the Division of Adolescents Development and Support, and the Family Violence Prevention and Services Division. The SRAE program is administered by FYSB's Adolescents Pregnancy Prevention Program. As you may be aware, the CARES Act of 2020 provided appropriations for your GD SRAE grants and the Title V SRAE program. The legislative authority is provided here and supports funding for the now fifth cohort of the GD SRAE grantee. The total annual funding has increased over the past 5 years from $10 million to $35 million. The Title V SRAE annual appropriation is now $75 million. The legislation is provided on this slide, and it is critical that grantees ensure that all programming complies with the mandated requirements to include exclusive implementation of education in sexual risk avoidance that is defined as voluntarily refraining from non-marital sexual activity. Other legislative mandates require that your program use medically accurate information, implement evidence-based approaches that meet the needs and desired outcomes for youth, and teach the youth the benefits associated with self-regulation, success sequencing for poverty prevention, healthy relationships, goal setting, resisting sexual coercion, dating violence, and other youth risk behaviors without normalizing teen sexual behavior. The Sexual Risk Avoidance Education Program supports state and community organizations implementing sexual risk avoidance education and exclusively teaches youth how to voluntarily refrain from non-marital sexual activity, It empowers youth to make healthy decisions and provide tools and resources to prevent youth engagement in other risky behaviors. The APP program supports 266 grantees funded at $159.65 million. There are 174 SRAE grantees, including 103 active general departmental SRAE grantees. Your organization is one of 51 newly awarded grantees. There are also 92 PREP grantees. Now I'm going to share some information about the program requirements and post-award activities as outlined in the GD SRAE funding opportunity announcement. The goal of the sexual risk avoidance education program is to exclusively implement education with youth on how to voluntarily refrain from non-marital sexual activity and to avoid related risky behaviors. Some of the objectives of this is to teach risk avoidance skills through methods that do not normalize teen sexual activity and target youth populations that are at risk for non-marital sexual activity and other risk behaviors. The SRAE program requirements include implementing curricula that includes medically accurate information referenced in peer-reviewed publications by educational, scientific, governmental, or health organizations, as well as selecting sexual risk avoidance curricula and other strategies with an evidence-based approach to integrate research findings with practical implementation that align with the needs and desired outcomes of the targeted audience and youth. We also teach risk avoidance skills through methods that do not normalize teen sexual activity, target youth populations that are at risk for non-marital sexual activity and other risk behaviors, and ensure the program is inclusive and non-stigmatizing towards all participants. When it comes to evidence-based or evidence-informed strategies, we want to make sure that the selected curriculum and overall proposal systematically applies key program elements that have been found to be effective in positive youth behaviors or changes. Your program should also link program participants to services with the local community, provide formal training, and teach the benefits associated with self-regulation, success sequencing for poverty prevention, healthy relationships, goal settings, and amongst other things. The programs must address the following topics. It must look at the holistic individual, as well as the increased likelihood of avoiding poverty, the fundamental components of healthy relationships and their impact on the formation of healthy marriages and safe and stable families. Your program should also look at how other youth risk behaviors such as drug and alcohol usage increases the risk for teen sex, and how to resist and avoid and receive help regarding sexual coercion and dating violence, recognizing that even with consent, teen sex remains a youth risk behavior. The SRAE program must include positive youth development as part of the risk avoidance strategy. Typical elements of program models implemented with a positive youth development approach include ongoing, structured activities that facilitate progressive skill building, positive interactions between youth, peers, and adults, and high levels of youth participation and engagement. SRAE programs must provide information that is medically accurate and age appropriate. Program participants should be able to distinguish between factual information and discussions of values and opinions that some might disagree with. The programming must be culturally appropriate to ensure that the content is sensitive to the values and norms of program participants. When it comes to curriculum fit and selection, the SRAE curriculum requirements are that they must be age appropriate with regard to the developmental stage of the intended audience, culturally appropriate, and linguistically appropriate. Exclusive purpose of teaching sexual risk avoidance and the benefits associated with self-regulation, success sequencing of poverty prevention, healthy relationships, goal setting, dating violence, and other youth risky behaviors such as underage drinking or illicit drug use without normalizing teen sexual activity. The interventions, material, and curricula must not promote or encourage sexual activity outside of marriage. And the curricula, interventions, and activities can provide information on contraceptives that does not include demonstrations or stimulation of contraceptive devices. In terms of fidelity, all SRAE programs are to be implemented with fidelity. Fidelity is critical to ensure the program is implemented without compromising the core elements of the curriculum that have been identified as essential for achieving program effectiveness. Fidelity plans and fidelity monitoring are effective tools to ensure the facilitators or educators are consistently teaching to the modules of your selected curriculum. SRAE programs may only provide education to youth on sexual risk avoidance. Funds may not be used to provide separate services such as healthcare, educational services, or career development. As needs are identified, grantees should provide referrals for necessary services, but may not pay for the services themselves with ACS funding. The Performance Progress Report, or PPR template, was provided in your grant guidance document emailed to you by your federal project officer and must be uploaded into Grant Solutions twice a year. Please refer to your Notice of Grant Award and Grant Guidance document for those dates. This PPR report must address or grantees are to provide narrative information on the following: major activities, challenges, significant findings and observations, organizational issues, TA and training updates, as well as activities planned for the next reporting period. The post-award activities required for this funding include initiating a full program functioning within 90 days of award or not later than December 1st of 2020, train the facilitators and educators and the program model or elements of the program model by professionals who can provide follow-up technical assistance to facilitators, register and support attendance of at least 2 key staff persons to the 3-day Adolescent Pregnancy Prevention Program Grantee Conference to be held in person or virtually in May 2021, and 2 topical training sessions offered each year of the project period, as well as collect and report on Office of Management and Budget approved federal SRAE performance measures. Additional activities include submitting PPR and other required reports during the 36-month project period for each of the 3 12-month budget periods to include a non-competing continuation application. Grantees must have sub-recipient or subcontractor agreements in place within 30 days of the grant award. And grantees must have a plan to monitor sub-awardee claims, address them seriously, and document their corrective action. I will now turn the presentation over to Olivia Ashley to provide you with information on the required performance measurement reporting.
Thank you, Alexandria. Hello, everyone. I'm Olivia Ashley from Public Strategies. Public Strategies and our subcontractor Mathematica are supporting the Administration for Families and Children with SRAE performance measures data collection, submission, analysis, and reporting. This role includes providing training and technical assistance to grantees on collecting and submitting performance measures data. First, I'm going to briefly explain the purpose of performance measures, benefits of performance measures data for you as grantees, and how performance measures are different from local impact evaluation. Next, I'll provide some brief information about the types of performance measures grantees will conduct and report, as well as data collection and submission timelines. And finally, I'll provide information about upcoming webinars and technical assistance events where grantees can get detailed information about performance measures collection and reporting requirements. There. The collection of performance measures is a requirement of the SRAE grant award and was specified in the federal funding opportunity announcements for SRAE. However, performance measures are much more than a federal requirement. They're an important and essential learning tool that will help assess progress towards the SRAE performance program objectives and compare progress from year to year. Regular collection and reporting of performance measures will allow FYSB to provide timely feedback to you as grantees for ongoing program improvement. FYSB also uses performance measures for reporting and responding to inquiries from stakeholders, internal and external, to the federal government. Performance measures also benefit you as SRAE grantees and your local stakeholders. Performance measures can arm you as grantees with data that you can share with funders and other stakeholders. You can use performance measures data to inform policymakers, partners, the media, research groups, and other interested parties about your activity. Performance measures can also be used as a foundation for program improvement. You can use performance measures data to monitor program providers and to assess, for example, whether programs are reaching their target population and whether the participants consider the programming helpful. The data also can be used to identify training and technical assistance needs your providers might have. Finally, performance measures provide data that can assist SRAE grantees in advocating for continued and additional funding and in sustainability planning. This table highlights the differences between performance management and evaluation. Performance management on the left measures input, which are the resources that make the program possible, such as funding, staffing, training, observations, curricula, and other activities provided to you. Performance management also measures outputs, which are the direct, tangible results of program activities, such as the number and type of youth served, the number of hours of programming delivered, the number of youth who attended programming sessions or activities, and the settings in which program content is delivered. Finally, performance management measures outcomes, which are the status of participants after services, such as participants' perceptions of the program's influence on their attitudes and behaviors. In contrast, on the right, local impact evaluation measures the difference in status of participants after services from status among a comparison group who did not receive services. And this contrast between a comparison group and participants receiving SRAE programming can establish a causal relationship between the program and the program impact. There are three categories of SRAE performance measures. Program attendance, reach, and dosage measure the delivery or implementation of the SRAE programs and will be described using data on the numbers of youth served, their attendance and retention, and how many sessions youth received. The second category measures program structure, cost, and support for implementation. This includes the program curricula, other activities that may be provided, settings in which they're provided, grantee organization and subawardee funding and staffing, and program providers' perceptions of implementation challenges and technical assistance needs. Participant measures include participant characteristics, behaviors, perceptions of program effects, and program experiences. This information is collected through anonymous surveys administered to youth participants at program entry and exit. There are two versions of each anonymous entry and exit survey, a middle school version and a high school and older version, because select questions about sexual behavior will only be collected from high school youth in grades 9 and above. This slide shows some of the response categories for the middle school entry and exit surveys and for the high school and older entry and exit surveys. However, the response categories are merely guidelines for middle school and high school grades, since which grades constitute middle school and high school vary across communities. Grantees will administer whichever survey best reflects the population they serve. Grantees will submit measures of attendance, reach, and dosage, and survey-based participant-level performance measures biannually, each winter and summer, and will include 6 months of data in each submission. Measures of structure, cost, and support will be submitted annually, each summer, and these measures will cover a full federal grant year. Measures of attendance, reach, and dosage will first be reported by new grantees in mid-January and February 2021. Grantees will begin administering the participant entry and exit surveys as soon as possible and will submit those measures mid-January and February 2021 as well. Measures of structure, cost, and support for implementation will first be reported by new grantees in mid-July and August 2021. We have several TA events planned. On November 19th, we'll conduct a webinar for new SRAE grantees, staff, and evaluators to provide detailed introduction to the SRAE performance measures. Grantees will receive information about how to register for this webinar very soon. On December 3rd, we will conduct a webinar on cleaning participant entry and exit survey data to prepare for data submission. On December 15th, we will conduct office hours for evaluators and data submission staff to answer questions about reviewing and submitting survey data. And January 14th, we will conduct a webinar to explain and demonstrate how to submit performance measures data to the web-based SRAE Performance Measures portal. For additional information about SRAE performance measures, please go to the SRAE Performance Measures website at www.sraepas.com. We are updating the announcements and webinar schedule on the website, but some of our staff in Oklahoma have lost power due to the ice storm there, so please consider the information that I just presented about webinars to be the most current if it contradicts the website. We anticipate getting the website updated later today or tomorrow. After you review information on the website, if you have additional questions, you may contact the SRAE Performance Measures Help Desk by emailing SRAE Performance Measures at publicstrategies.com or calling toll-free 833-797-0166. And remember that detailed information about SRAE performance measures for new grantees will be presented on the webinar next month. Now I'll turn the webinar over to Susan Zief to talk about the national evaluation of the SRAE program.
All right. Good afternoon. My name is Susan Zief. I am the project director for the SRAE National Evaluation, which is otherwise known as SRAE-NE, as the logo shows. My deputy project director, Heather Zaveri, will also get to know many of you in the coming months, but I'm going to introduce you to the 3 areas in which we work with you and other stakeholders in the field. So first, the SRAE National Evaluation has 3 main project activities. the National Descriptive Study, the Program Components Impact Study, and Data and Evaluation Support. I see many familiar names and organizations on the call today, so I'm sure you have some familiarity with what we do in each of these areas. And I'm thrilled to be able to introduce this to any new grantees and to also tell you what's coming next. Across these three project activities, there are some themes, and each activity represents this theme in one way or another. The first is to produce action-oriented evidence that programs and other stakeholders in this field can use to improve SRAE programs. Second, this evaluation doesn't operate in a bubble. It is informed by and infused by the knowledge from grantees, experts, and other key stakeholders in the field. And you'll hear a little bit about that today as well. And then finally, as an arm of ACF, the work we do and the work we support you in doing upholds ACF's evaluation priorities: rigor, relevance, transparency, independence, and objectivity. So I'll start with the National Descriptive Study, and this arm of the project will literally tell the story of SRAE programming, what you all are doing, how you are doing it, and what you're learning from it. So the very first phase of this is to describe program plans, and this is called the Early Implementation Study. It just completed. So unless you had a grant, unless you have another grant that was awarded earlier than this one, you will not be asked to complete the survey. But you will soon learn what your fellow grantees are doing with respect to their plans and early implementation experiences, such as how they're structuring their grants, the context in which the grants are being implemented. School sites, are they being implemented in community-based organizations? Who's facilitating these programs? Are they outside facilitators? Are they teachers within a school? The plans for the programs, including what curricula are being used and how our programs and if programs are being supplemented with additional content and additional activities. And for the state and competitive grantees in particular, how Title V programming is changing with the new legislative requirements and how the legislative requirements are being met through the grant program and activities. We're next going to move to what's being called the nationwide study. Here we'll do a deeper dive on implementation and lessons being learned from several years of programming. As part of this study, we will also examine the relationships between program implementation experiences and outputs and outcomes. And those outputs and outcomes will come from the performance measures data that Olivia just described. And then finally, we'll get to conduct some in-depth case study across a selected group of grantees and their programs where their story can really help propel the field forward. Next, I'm going to talk about the second arm of the study, the Program Components Impact Study. And I first want to make sure there is a shared definition of what program components are in the context of this work. They are what you would call the essential parts of your program. It's what you need to have in place for your program to be effective. They are vital for you to achieve your program outcomes. So here are some examples. The curriculum you may have chosen, both the content, the language, the age appropriateness, the supplemental activities that you may be adding to that curriculum to achieve your outcomes, maybe mentoring, maybe service learning, your facilitators, who they are, how they're selected, how they're trained, the instructional methods you use to deliver the content, and finally, some of the contextual factors, the extent to which parents are engaged, how they're engaged, how you're interacting with your sites and your settings, such as schools. So that's what I mean by program components. Now, we went through a process. So in this part of the evaluation, we will identify and refine components that the field feels are most crucial for the success of your programs. So to get to where we are now, we met with stakeholders and program experts to hear from them about what components they think make the most difference and should be of the greater interest to the national evaluation. We also went through a process then of considering, well, among those, which ones are most relevant to most grantees in the field and may be amenable to change. Next up, we're going to evaluate the implementation and outcomes of the program, of the components we identify to test. And when that is all done, we will have a menu of strategies to share with you that are evidence-based that can be used to improve your programming. And here's where we're beginning. For the Program Components Impact Study, we will focus on facilitation. This focus addresses the priority that all stakeholders consistently named as the area of greatest interest. They said if the facilitation isn't there, then the program's not going to make a difference. If the correct and appropriate facilitation isn't there, the program, no matter what content you're delivering, isn't going to make a difference. It's also really important to consider facilitation because although there is a large evidence on teacher preparation and facilitation, it's not within the context of SRAE. So by focusing on facilitation, we can address a key knowledge gap. And there are potentially very interesting questions that we can examine on this complex and broad topic. And I'll tell you in a moment how we're going to do that. Now, facilitation is also a core component of every single program. Therefore, focusing on facilitation is going to bring the greatest benefit to all. Now, next steps, how are we going to get to facilitation as this big topic to, well, what about facilitation do we want to work with all of you to improve? We're going to start talking to you. So within the next few weeks, some of you may hear from us, and we'll be asking you questions about how you facilitate your programs and what you might want to change and improve if you could. And finally, the data and evaluation support of this contract. This third leg in itself has two legs. So first, I'll speak to data capacity building. This really focuses on all of you, and it helps you use data and research to improve your SRAE programs and outcomes for youth. That, of course, can include performance measures, but it can also include other data that you're collecting or could collect to address very targeted questions you have to improve your programming. Here are some topics that we have used in prior webinars. Creating logic models to explain your program to yourself and to others, and to indicate areas where you want to track implementation and improvement. Developing a continuous quality improvement process and plan. We just recently conducted a webinar with 2 other grantees who then showed us how they create a learning environment that fosters continuous quality improvement. We gave a webinar and provided supplemental materials on how you can cost out your program. What does your program cost, and what are the per unit costs, like per student? Upcoming, we'll be introducing you to some fundamentals of evaluation, and we'll have a whole short video series on high-quality data collection. Now, I can't show you the website right now, but I will show you the link to the website in a bit. And I encourage you all to spend time on the website. If you are a new grantee, then there are a lot of resources, recorded webinars and other supplemental materials that will kind of catch you up and bring you up to date, so that as we conduct live and new webinars in the coming weeks and months, you will have benefited from what we did in the past. And if you are returning grantees and just didn't have an opportunity to hear some of our webinars or dive into some of our resources or toolkits, you can find them all on our website. And finally, we provide evaluation support for your local evaluations. We want to help you conduct the highest quality evaluation, whether it's an implementation study, a descriptive output and outcome study, or an impact evaluation. Our goal is to help you to make it the best. So the audience here are grantees conducting local evaluations. And I know that FYSB is very interested in encouraging more of you to do so. So that's another way you'll be hearing from us in the next several weeks, is to try and gather your interest in joining us and conducting impact evaluations of your program with our support. So as we support grantees in conducting local evaluations, we help them with things such as their evaluation design, the measures they may use to examine the effectiveness of the program, the data collection strategies, analytic techniques, and reporting recommendations. Most of this happens through individualized support, including conference calls and reviews of documents that are shared and passed back and forth. Please contact us. If you are planning a local evaluation right now, please email us. Here's our project email account, and we can help you make it the best that it can be. And then here's our project website. Please do mark it down. And like I said, review the resources you may not have had an opportunity to participate in up to now. On behalf of Heather Zaveri, my deputy, and myself, we really look forward to working with you. Thank you. And now I'm going to pass things to Dr. Jerry Regier, who leads the SRAE Training and Technical Assistance Contract.
Thank you, Susan, and good afternoon to everyone. This will now be a small section on the SRAE Training and Technical Assistance Contract, and I am with Public Strategies. Public Strategy is a high-performing, woman-owned small business, culturally and professionally diverse team with headquarters in Oklahoma City. And Public Strategies has been in federal contracting business for the past 20 years and are really experts in building strong linkages between program implementation, research, performance measurement, and public policy. Public Strategies is involved in all three of the contracts that you've just been hearing about. I direct the performance analysis study that Olivia presented earlier. We also are a subcontractor to Susan Zeef and Mathematica on the national evaluation. And then we had the training and technical assistance contract. The team is fairly large because we are going to be interacting with you as grantees. And so I wanted to just take a minute for you to see on the screen who the team is. I will be the project director. And we had this contract and led the TTA last year for the SRAE grantees as well, so this will be our second year. Michelle Watson is project manager, and we have several senior advisors, Mary Myrick, Kendi Cox, Beth Clemens. Connie Huber is our project coordinator and leads tasks 3 and 8. Task 3 is the individualized technical assistance, which I'll be talking about in just a minute. And task 8 is the site monitoring task. Jennifer Nettle will lead task 4, and that is the off-site technical assistance, and I'll explain that in a minute. Kaylee Biddy and Marianne Mozak. Marianne is with our subcontractor, Ascend, and they work on the task 5, which is the topical trainings. Then we also have the annual APP meeting sessions, which we are assisting RTI, which leads that APP conference. And you may want to make a note that that conference will be taking place in May 11 through 13. It's planned to be taking place in Atlanta, but may end up being virtual. We will see. And then Ashley Simons Rudolph is the task 7, where we have some briefings as well as developing profiles on each of the grantees. Additional TTA personnel from Public Strategies, Azalai Israel, Scott Roby, River Cheater, and consultants as needed. And then our subcontractor is Ascend, and their staff, Marianne Mozak, Melissa Walther, and Tracy Pike. So the activities in TTA, and let me just say that when we talk about training and technical assistance, if you training and technical assistance on the performance analysis study, then you would contact your FPO and talk to Olivia and the staff. If you're needing TTA in evaluation, you just heard Susan present that, and so they provide evaluation assistance. So when we're talking about technical assistance here, we're talking about the programmatic side of technical assistance. The first activity is the topical trainings, and we will be doing 2 topical trainings. The first one for sure will be conducted virtually, and it will be sometime in the first couple months of 2021. And this is an opportunity for peer learning approaches and expert engagement. And you're required to send someone to one of the topical trainings. And we look forward to that. We had a great topical training virtually in September. And because it was virtual, we had almost 300 registered. Normally, the topical training is around the 75 to 80 mark, and you will be hearing more information about that. And then individualized TA through phone, video conference, email, written materials, face-to-face. TA workshops for 2 cohorts are being planned, and one would be the cohort of new grantees, which you're a part of, and the other one with refunded grantees, and we're looking for 35 off-site TA contacts. And let me just say that when we think about technical assistance, sometimes grantees feel like if I ask for help, it shows I don't know what I'm doing. Nothing could be further from the truth. The whole point of technical assistance is to come alongside you, to bring experts, to bring FYSB staff, to bring my contract staff, and to assist you by sharing things and even putting you in touch with other grantees that may be having the same issue you're having. So please don't think of this as something negative whatsoever. Technical assistance activities is here ready to help you and assist you, and you should line up for it because it's a great opportunity. The off-site TA will be an informational series, and we are looking at creating different series that would include a webinar to give good information and background on whatever the topic might be, and then a tip sheet on that topic, and then the opportunity for grantees to come together in what we call a cluster call so that you could interact with one another, and there can be peer interaction taking place and questions being asked of the expert on that particular topic. Site monitoring, we'll do some virtual desk audits, and we do that in concert with the FPOs. And then, as I mentioned, the APP conference session, which we assist on the SRAE side of the APP conference. And that will be, as I said, May 11 through 13 in 2021. Let me also say that you might be looking forward to, okay, what kind of topics are you going to be doing this year? And we're just in the process of putting together that work plan. But while you're getting started, you can always go to the exchange because on the exchange are all of the technical assistance webinars, tip sheets, cluster call recordings, all of that, even the topical trainings and all the sessions are on the exchange. And so you as new grantees can really utilize your time by going to the exchange. We will be doing many of these for you over the next months, but you don't have to wait. You can see much of what took place last year on the exchange and could be very helpful to you. So we look forward to working with you on the TTA side, and please stay connected with Public Strategies and with your FPO as you desire to have different opportunities to improve your programming. And now I'll introduce Owen Burns, who is with FYSB as the Communications Manager.
Great, thanks, Jerry. Hello, everyone. I am going to introduce you today to two really great digital destinations that you could leverage in your work and working with your youth. The first is the first resource. You've heard him mentioned already. Jerry just gave us a great plug for it. It's called The Exchange. You'll see the web address right here on the slide. The Exchange is an online resource repository that houses a wealth of TNTA products, tools, and resources for GD, SRAE, and all other grantees to use in their programming. There's a great video introducing the site right on the homepage with information about its features and functionality. Please be sure to visit the site, not only because you can find all those great things that Jerry mentioned. There's a lot of stuff there also, but there's also that video. And it'll give you a really good introduction and sort of a tour through the site. I noticed in the chat box that some folks had hit the site already and were trying to get in, and it was blocked. There is a membership side of the site, and I think Connie actually sent out a link to the registration page, so you can follow that. I'll post a link to the introduction video here in the chat in a few minutes. Although the video does this better, I'm going to try and tell you a little bit about available content and resources, some of which, as I mentioned, only available if you're logged in. So be sure you guys all go out there and set up an account as soon as you can. The site offers you ways to connect through the comment wall, which facilitates engagement with other grantees and TNTA support, information and access to our partners in that TNTA support, and info and links to technical assistance and training opportunities as well. You can create materials on the Exchange using the Studio, where you'll find customizable infographics, web badges, tip sheets, and more to leverage in your programming. There's also, one of the pages I think you'll spend quite a lot of time is the resource page, where you'll find a resource gallery with all manner of tip sheets, webinars, toolkits, research reports, infographics, and more. The events page is a great place for folks to visit to find out what's coming up. We post events, national observances, and other things on that calendar. So again, if you're not registered for the site already, don't worry, just visit the Exchange. There's a register button in the upper right-hand corner, and once you click that, you'll see some instructions and directions there, as well as the link that's in the chat that Connie put up. And if you need help with it, I'm sure your project officers will be more than ready and willing to help. The second destination, Liz mentioned this at the top of the session here today as one of her favorites, is the We Think Twice campaign. And the We Think Twice campaign is actually a result of a collaboration between the Administration on Children, Youth and Families, Family and Youth Services Bureau, and the Office of the Assistant Secretary for Health. We Think Twice, along with a number of other SRAE resources, are intended to support grantees' ground-level efforts working with youth, what you guys do in your interactions with the youth. On the ground is a really good way actually to describe how this site was designed and built. It really was an effort to engage youth and leverage their ideas and input to create the campaign component and help promote healthy decision making. The campaign was initiated on social media, Instagram and Facebook, then followed up shortly thereafter by, got a little far ahead of myself here. then followed up and complemented by the We Think Twice website. Again, you'll see the web pages or the web addresses there on screen, along with a number of our Instagram posts. We Think Twice hosts a lot of engaging for youth, including messages on healthy relationships and avoiding non-marital sexual activity, facts about youth behavior, scientific content about the brain, inspirational and motivational messages, all delivered in a fun and engaging way through animated and engaging visuals, infographics, games, quizzes, videos, and a lot more. The next slide actually shows us some of those additional resources I mentioned. And you'll see a few of them right here. These tools are designed to help individuals and organizations working to support youth in states and in communities. We continue to develop more content for the We Think Twice campaign, as well as other resources like those that you see here. So continue to visit the site, continue to visit the Exchange Resource Gallery, and you'll find a lot of these tip sheets, toolkits, source books, things like that. So the last thing that I have for you today is just a final note. I wanted to remind everybody about a webinar coming up on Monday, November 10th from 3 to 4:30 Eastern Time. That'll go into greater detail about the collaborative work FYSB and OASH are doing. Invitations have actually already been sent out, and as a matter of fact, I saw a reminder go out today. So we encourage everybody to register for this webinar. You'll learn a lot more about the campaign and the collaboration, and we really encourage you to also leverage these resources, the website, the tip sheets, toolkits, et cetera, and apply that to your work and your programs. If you didn't get that email invitation or the reminder, don't worry. You can touch base with your project officer who can forward it to you or refer you to a registration link to sign up. So that is it for me. Thank you very much, everybody. Our next presenter is going to be Alexandria, Washington.
Thank you, Owen. The next few slides will provide information on the APP Program Office's role in the administration of grants. The role of the APP Program Office is to review applications and programmatic reports, respond to programmatic and technical aspects of the grant, ensure the amounts to be awarded to the grantees are consistent with current statutory requirements, and monitor grantee performance. Project officers are the contact person for any programmatic changes or updates. Below are examples of when you should contact your project officer. Some of these examples are for programmatic requirements, any changes in program modifications or changes in project scope, budget revisions, changes in key staff positions, program progress reports, for monitoring and site visits, as well as technical assistance. The main objectives are to ensure the project is in compliance with the terms and conditions and the authorizing legislation. It's also to discuss the project's development and observe the project during implementation and provide programmatic, financial, and evaluative guidance and a certain technical assistance needs. Project officers will provide prior notification to grantees when in-person or virtual site visits or site monitoring visits are scheduled. Ongoing technical assistance is provided through emails, webinars, conference calls, virtual meetings, site visits, and site monitoring visits. Now I will pass it off to our Office of Grants Management colleagues, Trang Lee and Ronnie Brooks, who will provide you with information on the fiscal management of your grant.
Thank you, Alexandria. My name is Trang Lee. I am the Grants Management Specialist. So today I'm going to give you an overview, the role of the Grants Management Office. The Grants Management Office, we are responsible for fiscal management and administration of grant award. We are ensuring the grantee comply with the applicable laws, regulations, policies, and procedures, and technical aspects of the grants, and the fiscal monitoring. We provide guidance on the fiscal requirements related to grant awards, terms and conditions, post-award changes, reporting, and closeout procedures. The contact the Office of Grants Management for the following: requesting amendments to the original grant application, such as changes in key personnel, budget modification, carryover, and no-cost extension. The Office of Management will also provide a clarification of the budget issue, particularly allowable costs. We also provide guidance on submitting fiscal reports and other official correspondence. This slide about the grants policy and regulation. The SRAE grantee is subject to requirement of the grants policy. HHS grants policy statement. It provides the general terms and conditions for all HHS discretionary grants and cooperative agreements. It also apply, SRAE grantee also apply the 45 CFR Part 75. It covers the uniform administrative requirements, cost principle, and audit requirements for HHS awards. Another grants policy and regulation is the OMB Circular 2 CFR Part 200. It covers the uniform administrative requirements, cost principle, and audit requirements for federal awards. Below is the link to the above grants policy and regulation. This page, I'm talking about a little bit about the payment management services, also called a PMS. The PMS is a part of the HHS Program Support Center, which is separate from the ACF. The PMS provides the payment and accounting system for all HHS grants. So the grantees are responsible for requesting payments and reporting disbursement to the payment management system. When it funds, the grantee has to spend funds within 72 hours after requesting drawdown. The payment management requires the grantee to submit quarterly report to the payment management system. And this is the PMS website. You can visit to find out the FSR due date and also the PMS accountant contact info if you need help for the system access or the drawdown questions. This is the PMS help desk phone number in case if you need to contact for the account assistant. The next few slides, I'm going to talk a little bit about required reporting. The performance progress report is due semi-annually and submit the report to the grant notes by Grant Solution. It is due 30 days after the end of reporting period. The project period start date September 30 through September 29th. So your first report is due April 30, covering from September 30 to March 31st. And then the second report is due October 31st, covering April 1st through September 29th. This is another additional required federal financial reporting, SF, the form called SF 425. The FSR SF 425 must be completed and submitted through the payment management system. Just want you to know that this is the FSR in addition to the quarterly FSR with the PMS. This FSR SF 425 is due semi-annually and it's due 30 days after the end of reporting period. And the annual SF 425 is due 90 days after September 29th. This report, we expect the grantee or the unliquidated obligation must be liquidated by December 30. It's for its budget period. the report, there's a 3 report due from the FSF 425. The first report is due April 30, covering the first 6 months from September 30 through March 31st. And then second report is due October 31st, covering the second 6 months through September 29th. And then the annual report is due 90 days after the end of the budget period on September 29th. So it is due on December 30. The SF, another required as the SF 428 tangible personal property report is required when the grantee receives the approval of the equipment purchase of $5,000 or more per item. And this SF 428 has 3 parts. It's an annual report is called SF 428A. The final report is the form called SF 428B, and the disposition request report is called SF 428C. The annual report is required applicable and submit this report to the grant notes in Grant Solution. Now I'm going to turn it over to my colleague, Ronnie Brooks, to continue OGM presentation.
Good afternoon, everybody. This is Ronnie Brooks. And so just to continue, only authorized officials and project directors or principal investigators roles in Grant Solutions have access to make any requests or upload documents. Other roles have read-only access. OGM is responsible for ensuring that the AO and PD for grants have access to Grant Solutions. So if you ever have any trouble with that, please make sure you contact your grant specialist and we'll take care of it for you. Also, there are times when you may have another person in your organization that's responsible for doing certain things related to the grant, and they need access to Grant Solutions. And so if you ever find that happening, then just contact us and we can always add another person if there's someone else in the organization that needs access as well to take care of certain things for you. Grantee control over the submission of post-award amendments basically just means that whenever you all need to make any type of changes or requests, you are the first step. You submit your request via Grant Solutions and Grant Notes. And it's best if you can to maybe shoot your program officer, program specialist email to let them know what you're requesting and that you have uploaded something to Grant Solutions. And then they will, after you submit your request, then they'll pick up the ball from there and then it finally comes to us. But always contact us via email or phone with any questions that you might have if there's something that you feel like you need to do. Okay. Change in scope, change and or absence in key personnel, transfer of funds budgeted for participant support. These are things that you need approval for if you would like to request changes. No cost extensions, significant rebudgeting, or a need for additional funds. One of the most important ones is transfer of funds budgeted for participant support, mainly because it's important that we know that whatever monies you're moving around, that it's not going to impact in a negative way services to your clients. Budget modifications or significant rebudgeting. Please submit requests as an amendment, as I said, via Grant Solutions. Required documents, this is important, cover letter, SF 424, a revised SF 424A, which is your budget sheet, and revised budget line item justification, and any other supporting documentation. Please make sure that anytime you're sending correspondence or cover letters or anything like that, that you put your grant number at the top of that. We greatly appreciate it. Visiting Grant Solutions training video for instructions. On post-award amendment submissions, there is the link for Grant Solutions, and they have all types of videos that will be helpful to you. And they also have a help desk phone number if you need specific help in doing anything in Grant Solutions. Please note, prior approval is not required for budget modifications when the federal share of the awarded budget exceeds $250,000 and the transfers between direct cost categories is below 10% of the total awarded budget. If the federal share of the award budget is below $250,000 and the cumulative transfer between cost categories is below 25% of the total award budget, prior approval is not required. Carryover of unobligated balances. These funds are to be used to complete unfinished activities from the prior year, and the cost should have been reflected in the approved prior year budget. So just saying that anything that you all find that you're going to have left over at the end of a budget period, you may request to carry over that amount to complete things that weren't able to be done. But that's it. You can't carry money over just because you had it left or to start new activities. It has to be to complete something that was already approved and for some reason you weren't able to do it. Carryover balances should be requested as soon as possible after the submission of your annual SSR, financial status report, and it must be completed via managed amendment, in Grant Solutions. And basically the same required documents: cover letter, SF-424, SF-424A, your line item budget justification showing only your carryover amount, and the line items that it belongs on, and the annual 425, which shows your unobligated balance. Because of course, if you're making that request, the amount you're requesting should be what you have left or below that. No cost extensions are requested to complete activities of the grant in the final year of the project period. Requests are not approved merely for the purpose of using unobligated balances. Please remember that. Requests should be made 45 days prior to the end of the project period. And I apologize, this slide needs to be updated. It says one-time extensions up to 12 months, but that's not completely accurate. You may make more than one extension request if it's necessary, but the total of all the requests cannot exceed 12 months. So many grantees will just request 12 months when they make their original request, but sometimes you may not think it's necessary. You may think you need 4 months, 6 months, whatever it is, that's fine. And then if you find out you still need more time, that's perfectly fine. You can request another extension, but the extensions together cannot total more than 12 months. The no-cost extension does not authorize additional spending or any new activities beyond the purposes consistent with the original award. Now I'm going to, follow instructions in Grant Solutions for requesting a no-cost extension. Requests will include, same thing, 424, the cover letter, the revised expiration date, the supporting reasons for your request, and the remaining balance. All 425s, all program progress reports from previous and current budget periods have to be submitted as well. Everything has to be current before we can make any approvals. I'm going to now turn it back over to Labrita.
Thank you, Ronnie. Good afternoon. Thank you. Good afternoon, everyone. I am Labrita White, one of the APP or Adolescent Pregnancy Prevention Program Managers. And I must say, I'm quite delighted to be able to congratulate you on your awards. The APP team, the federal team, as well as our partners, our contractors, We're looking forward to working with you throughout your 3-year project period. And so just to, again, emphasize, we have several contractors. You've heard from many of them on this afternoon. Just to reiterate that for you, we have the Sexual Risk Avoidance Training and Technical Assistance contractors. Jerry Regier shared information about public strategy services that are available to you, and I strongly encourage you to take advantage of those, as well as Public Strategies is the contractor for the Sexual Risk Avoidance Performance Analysis Study, and that's, in essence, that statement includes the submission of your performance measurement data, and again, Olivia Ashley provided you great detail on what's included there and informed you that future webinars are planned to provide even more detail on the collection and submission process. Mathematica Policy Research, we heard from Susan Thief this afternoon, and that particular contractor is leading the Sexual Risk Avoidance National Evaluation, and so there are opportunities for training and technical assistance through the staff with Mathematica. And then finally, Gray Matters. You did not hear from that contractor on today, and we at the federal level will be sharing additional information with some of you or many of you regarding the medical accuracy review process for some of the curricula that you've proposed to implement during your project period. So just wanted to emphasize that we work in tandem in partnership with our contractors, and we consider you as our grantees a partner as well, as we all have the same goal in mind, and that is to provide youth across the nation with quality and effective services and programming so that they can make the best and most healthy decisions as they navigate through adolescence and on into adulthood. So I'm standing between question and answer, so I'm going to be very brief with some of the additional closing remarks that I have, but I do, again, want to strongly encourage you to take advantage of our training and technical assistance services, and not only that, take advantage of them even now before you begin. Some of you have begun with program implementation, and others, you're still completing activities to move towards that. And as was shared today, and as stated in the funding opportunity announcement, the expectation is that services are implemented or your programs begin implementation within 90 days of award. And so that's by the end of December, the 90 days. So about 60 additional plus days available for you to begin your work with youth. Secondly, I want you to be aware that we did share with you a survey via email. The survey requests some critical feedback on how COVID-19 is affecting your projects. You know that we're in the midst of a pandemic still, and it has had impact on schools and community-based services available to youth, as the accessibility and availability of youth. So in order for us on the federal level to gain a little bit more information about what that impact is or the effect that it's having on projects, we have disseminated a survey. That survey was shared via email. If you did not receive it, I would ask and strongly encourage you to reach out to your federal project officer to obtain a follow-on email regarding the survey. It's fairly limited as far as time for completion. There's a total or maximum total of 16 questions. There are some skip patterns, so it could be fewer questions depending on how you are planning to implement your projects. But please take advantage of the opportunity to share your feedback with us. And we have a close date for the survey of Monday, November the 2nd. So again, if you do not have that in your email, please reach out to your project officer for a follow-on copy or the link to the survey, I should say. Okay. Let's see. And lastly, just want to close out today's presentation by sharing with you that you're invited to visit all of the websites that were shared with you with the presentations that were given for the orientation webinar on today. And here are additional
websites, and the links are provided for you here. Take advantage of the valuable information that's available to help support and enhance the work that you're doing. Again, I just want to say congratulations. We're going to now transition into questions and answer. We have approximately, it looks like 7 minutes remaining for today's webinar. So we'll look into the chat box, and I believe that Julie of Public Strategies will help us and support the sharing of any questions that may be in chat that we can respond to on this afternoon. If there isn't sufficient time for us to respond to all of the questions that you have, again, reach out to your federal project officer for answers to those questions, concerns that you may have, and we'll certainly respond to you in a timely fashion. Again, congratulations, and I'll turn the question and answer session over to Julie. Julie?
Thank you, Labrita. We've also invited Connie Huber to moderate for Public Strategy, so she and I can work together to answer your questions. It looks like Vicki Drager has a question. We received our award September 29th. If we have 90 days, isn't that closer to January 1 than December 1?
Yes, that is correct. And so December, technically it would be December 30th, and I think that falls on a Friday. And depending on where you are with program activities, I would say check in with your project officer as well. But the funding opportunity announcement does state 90 days after award. So December 30th.
Great. Do new grantees have anything due this Friday? Just looking at some of the other comments in the chat box.
I'm not aware of anything that is due on this Friday. We do have the COVID-19 survey that I just mentioned that closes on November 2nd. Not aware of anything that's due on this Friday.
Cindy has a great question. Could you please comment on incentives? Are there any parameters?
There are parameters for incentive, and it's probably more advantageous to discuss what type of incentives you have in mind for program participation or responses to follow-on responses to exit surveys and the like. From program to program, it does vary. I would say please check in with your federal project officer for specific questions that you have around incentives. Incentives are allowed, but there are some parameters and boundaries for how we make decisions on which ones are approved.
Great. Matthew has a question. The FOA said performance measures will be distributed to prime recipients and funded subrecipients who will be required to report on these measures approximately twice a year. Are these measures, he's assuming that these measures will be those that were distributed to existing SRA grantees earlier this year, is that correct?
Labrita, would you like for me to take that? Okay. Well, the participant entry and exit surveys that were distributed to existing grantees in July will not change. And I saw another question asking when will we receive new entry and exit surveys? You will not. They're the same survey measures that we've been using since July. The attendance reach dosage and structure cost support measures are largely unchanged, but there are going to be some small changes to questions about COVID-19. And we're in the process of reviewing those changes and getting those approved. And as soon as those are finalized, we'll make sure that all grantees are notified.
Thank you. And there's some question about a first cash report. Is that due October 30th?
Yes, that is correct. The FSR, the Federal Cash Transaction Report, is due October 30.
Thank you so much. And exactly how many folks from an organization have access to the exchange?
It's unlimited access, and what we ask is that the primary contact that's on the grant, as stated on the SF424, the application, gives clearance or approval for persons to be added. We want to make certain that those who have access to the comment wall and some of the other features and functionality that Owen spoke about are legitimately associated with the grant project. So that includes the grantee as well as subrecipient staff as well. Hopefully that answers.
Thank you. David indicates that they're a new grantee. So will they get assigned or notified about who their program officer and or specialist will be?
Yes, everyone should have been contacted. I would ask if you would reach out to myself, Labrita White or Renee Martin. If you have not been contacted by your, or if you're an organization that has not been contacted by the federal project officer, and I will insert, work to insert my email address into the chat.
Great. And can schools be incentivized to partner?
The answer to that question is yes. Depending upon what type of incentive, dollar amount thresholds, and the like, it would be best to have a conversation with your assigned federal project officer to explore what the options are there. Based on what's in your approved budget that was submitted with your initial application, and if there are any proposed changes that you'd like to make moving forward.
Thank you. And we're right at time for our webinar, but I'd like to answer one more question. Is there guidance or a template for medical accurate age appreciate review that will be shared?
I'm sorry, can you repeat that question?
Yes, the question is there guidance or template from medical accurate age appreciate review that will be shared?
Yes, there will be, yes.
Great. Well, it looks like we are at time. Labrita, do you have any final closing words before we close out our webinar today?
Actually, I do not have any remarks outside of thank you so much for your participation. I did get a chance to look at the participant roster, and it appears that we had well in excess of over 140 participants, including presenters and federal staff on today. So thank you so much for your time and attention. We will also work to make the slide presentation available to you within the next few days. As you know, it does include some really critical information that supports your ongoing planning and movement towards implementation. So I would close out by saying thank you again and have a great evening and continue to be safe and take care.
Thank you all for joining today's webinar. We certainly appreciate your time and your attention. And just as Labrita mentioned, the webinar has been recorded, and the recording and the slides will be available soon on the Exchange. Thank you again and have a great day.